Welcome, everyone. My name is Sandra Clarkson. I am the Executive Director of the Calgary Drop-In Center and co-chair of the Canadian Shelter Transformation Network, along with James. James, do you want to do a quick introduction?
Oui, bonjour tout le monde. Très content de vous voir en très grand nombre. It's great to see everybody. James Hughes from the Old Mission in Montreal. Just very proud to co-chair this network with Sandra. And I think we've got a really interesting, exciting presentation by Ian today, as always, by Ian today, which Sandra will tee up for you.
Yeah, thanks, James, and happy to be here with you. I think, through the pandemic, the Canadian Shelter Transformation Network has been on, a bit of a hiatus due to having, other priorities, as we all have, dealing with the impacts of COVID. And I think, despite the challenges that came out as a result of COVID, there were also, certainly from my perspective, many gifts or positive things that happened as a result. And I think, one of the things for us that's become clear is, the recognition of the interconnectedness between health and housing, and that those systems can no longer operate in silo. I think the increase in collaboration among organizations working within the homeless serving sector to come together for a common goal was also very much a positive. I think, recognition of the need for an increase in affordable and deeply affordable housing has also come out as a result. And also, recognition of the poor working conditions in shelters that are a result of chronic underfunding, under-resourcing, and how can we work to address that. And I think as shelters, we really pulled together and came up with innovative, creative solutions in the moment. And I think, there's recognition that with appropriate resources and a housing-focused philosophy, that shelters can truly be the engine to end homelessness. And so I think this is a really interesting time as shelters across the country. And I think the information that Ian's going to share with all of us today, which is updated guidelines on low barrier housing focused shelter. This is a real opportunity for us to really help push towards ending homelessness in each of our communities. So look forward to hearing Ian's presentation. And for those of you who don't know Ian, he's the CEO of Orco Consulting and has been doing this work across the continent and is instrumental in creating the transformational shift in terms of what shelters could and should be. And that's focused on the outcome of housing. So with that, Ian, I will turn it over to you and look forward to hearing what you have to share with us today.
Thank you so much, Sandra and co-chair James, and to all attendees today. Thank you for making some time to join us in this very important conversation around low barrier housing focused shelter and the possibilities that exist in this space, as Sandra said, to use shelters as one of the engines or as the engine to demonstrate reductions in homelessness by meeting people where they're at, understanding what their most immediate needs are, but keeping our eye on how do we help people exit as rapidly as possible to safe, appropriate, and as necessary supported accommodation. It is really my pleasure to be part of this webinar today and to outline for you the updated introduction to low barrier housing focused shelter. I would like to continue with a land acknowledgement based upon where I'm at, and then continue into the content of the material that I have for you today. So I am located in Halton region, which is west of Toronto. This is an area rich in the history and modern traditions of many First Nations and the Métis. From the lands of the Anishinaabe to the Attawandaron, the Haudenosaunee and the Métis, the lands surrounding the Great Lakes are steeped in Indigenous history. At ORCODE, we acknowledge the footsteps of Indigenous peoples that have marked this land for time immemorial. At ORCODE, we acknowledge the contributions of Indigenous peoples past, present, and future, and we especially acknowledge the Mississaugas of the Credit First Nation for being stewards of this traditional territory. Thank you. When we start to think about a housing focused shelter and the possibilities of what it presents, The purpose of creating this resource was trying to come up with something for shelter operators or shelter providers, a bit of a context where we at in being low barrier and housing focused, as well as for broader communities, allied professionals, other homeless service organizations, funders, philanthropy, interested parties, on how we can orient our shelter services to be as inclusive as possible for people with higher needs, and to make sure that shelters are not a destination unto themselves, but that they are a pathway by which people can get reconnected to the solution to their homelessness, which is going to be housing, whether that's through independent housing, housing with supports, permanent supportive housing, family reunification, or friendly reunification when safe and appropriate to do so, etc. So the impetus behind creating this was as a bit of a reflective piece for practitioners, as well as a bit of an educational piece for others in the community on what low barrier housing focused shelter can really look like. In terms of why it's needed, it's safe to say the shelter practices continue to evolve. Not every shelter by any stretch of the imagination is exactly the same. That's based upon everything from the clientele that is served, to the staffing ratios that you have, to what sort of housing resources you have, connectivity to coordinated access. All of those things and more can influence the way in which shelters operate. But if we're really going to focus on ending homelessness, a couple of things seem to be true based upon the work that has happened in shelters both in Canada as well as in the United States, which is, one, we need to make sure that our shelters are as accessible as possible to individuals, couples, and families with deep needs. So really starting to think through, what does it mean to lower barriers? I think coordinated access has helped move this discussion along in many communities. If we are going to prioritize people with some rather deep needs, or sometimes referred to as higher acuity, for our various housing programs, can those same individuals, couples, and families that we're prioritizing through coordinated access even access our shelters in our community or not? And then the second element that we really want to focus on is ensuring that it stays housing focused. And this is where it remains quite mixed. There's everything from shelters that proclaim to be really housing focused, but their operational strategy doesn't actually support it more than lip service. There are other instances where some shelters say that they're low barrier, but then you look at their rules and policies and come to realize that they're actually quite exclusive. So think of it as a bit of a challenge to all of us to continue to meet people where they're at, figuratively and literally, in the space of sheltering. And the intention of this particular document is not to be the be all and end all operationally, but to provide some context for those operator discussions and community-based discussions on the rightful role of shelter and its contributions that are so important towards ending homelessness. So I want to walk you through what exists in the document and provide a bit of context for each of the major sections that exist within the document itself. The first part of the overview is really starting to define exactly what we mean by low barrier housing focused shelter. One of the things that is really clear in the discussions about low barrier is that without defining really what low barrier means, it gets interpreted in many different ways. So you can have moderate barrier shelters that think that they're low barrier, or you have a community that pushes a shelter to be low barrier, but then you look at their operations and policies and procedures, and they actually already are lower barrier. So what does it mean to be low barrier? And then from the housing focus perspective, what that really means in practice is a process of progressive engagement in really looking at how do we maximize the resilience that exists within people. How do we help them be the best versions of problem solvers, allow them to have an active voice and choice in determining the housing solutions that they think are in their best interest, but making sure that we don't lose the thread of the housing conversation in all of the aspects of our shelter operations. So from that initial engagement or reaching out for shelter services, maybe that's in person, maybe that's over the phone, to what does that initial interview or intake or engagement or assessment look like with staff, through to what does this actually mean in terms of the roles of staff within the shelter across different shifts, moving away from an idea that housing work in shelters is only done by housing specialists. There can still be specialized roles, but that every staff person within a shelter environment has a role to play in moving towards housing as the solution to homelessness. In the next part, we try to get at some of the communication aspects. And in this part of the tool or the guide, what we're really doing is saying there are four main entities that need to understand what being low barrier and housing focused means. The first, foremost, and most obvious, the people that use your shelter, your clientele, your guests, the whatever language you use to describe users of your shelter. But they need to be fully aware that there's not a trick here. We're not trying to dupe people. This isn't punitive. What does it mean to enter into a space of being housing focused? And this can mean that the ways in which we communicate with people at different intervals within their shelter stay changes, but being really upfront in the initial engagement around the intention of housing. Management and staff need to be on the same page. This is part of a change management process that exists in a lot of shelters, in so much as we sometimes have supervisors, directors, managers, executive leadership that gets on board, says, okay, we're going to be housing focused low barrier, but they don't necessarily do a great job of working through the change process with their staff and helping their staff fully understand and be equipped in delivering housing focused services. I think that's in some ways kind of akin to earlier days of housing first, where without really having good descriptors of what it meant in practice, lots of organizations or programs indicated they're housing first, but maybe they weren't actually operationally. Certainly that's improved a lot across the country. That funders need to be aware. And while some funders lead the movement towards being housing focused and low barrier, not all do. And some funders can be suspicious of what these changes actually mean. And the biggest challenge that I've encountered with funders in this space is they think that the emergency shelter part is lost when you become low barrier and housing focused, and it's not. It still remains an emergency shelter providing emergency accommodation. It still provides for access to immediate needs, still provides emotional supports, still provides a safe environment. None of those aspects of sheltering change, just the orientation towards solutions rapidly changes, and making sure the broader community understands. So there's usually an education campaign or some sort of knowledge transfer that has to exist. Sometimes that's done through websites, social media, community meetings, part of the planning process. If your community has a plan to reduce or end homelessness, to really explain the functional role of shelters in that space. When we think about delivering housing focused shelter, much of the service orientation that we embrace when doing the work of housing and supports becomes fundamental and foundational to the work in which we do in the environment. So things like being trauma informed and really breaking down how housing focused shelter that is low barrier is really beneficial to people that have experienced trauma and resists re-traumatizing people through the process of rapidly helping people exit from homelessness. That harm reduction is a core feature of the work that we do, especially on the low barrier side of things, but making sure that there's alignment between our desire to reduce harm within shelter, but then not increase expectations, rules, or improve or increase barriers for people who are leaving shelter. That it has to be culturally appropriate and safe for a broad range of entities, everything from meeting the needs of Indigenous peoples to the 2S LGBTQ plus community. That we have to make sure that we understand what it means to be person-centered in practice, And so as we start the talk about being housing focused, it's not one size fits all. It really looks at the unique strengths and characteristics of each person, couple, or family that's being served in the space. The compassion isn't lost. So this is very much a transformational approach to sheltering as opposed to a transactional approach to sheltering, and that we are assertively engaging and borrowing a lot from assertive outreach in the ways in which we think about staff functions, so that we're moving away from what exists in some shelters, a very passive engagement. Staff are present, but the actual guest has to go to the staff to articulate their need, to actually having staff think through which individuals in shelter do I need to reach out to or in reach to have specific conversations relative to moving forward with housing. The benefits of having people with lived experience is a feature that we really more robustly articulated in this version of the guidance. What we've come to realize in a lot of the work that we've been doing with different shelter providers is that there's a missed opportunity to really engage with shelter users, both previous and present, to ask people with expertise of having been sheltered in your programs how they could lower barriers or make it more housing focused. So what are their insights? They can review your policies, procedures, rules, standards. They can look at your workflows. They can critique the ways in which conversations are had, where they're had, when they're had, and the content of those conversations. They can become advocates alongside the shelter provider for additional resources to assist in the housing process. And that if we don't gather and use this information, we're continuing to reinforce this idea that shelter provider is the exclusive expert, and we miss the contributions of people who have a very unique perspective on how to improve our services. In terms of safety, in considerations of safety, in this regard, we're really focusing first on the aspects of low barrier doesn't mean unsafe. And the reason why is there seems to be this misunderstanding that every time we go about lowering barriers, we're putting other shelter guests at risk, as opposed to how do we have a well-managed, person-centered approach to sheltering that actually looks at having really strong safety protocols, so long as we understand what safety means from the end user. And some of you might be familiar with this sort of framing. It's used a lot in trauma-informed care work relative to how safety is perceived from someone receiving services versus what safety is often looking like for people providing services. This means that when we think through a safe environment and its necessity for moving forward with housing focused engagement, that if people don't feel safe, staying in shelter is probably going to decrease exponentially. Engagement with staff is probably going to be more difficult, and realizing outcomes associated with housing can also be very challenging. We then transition to a whole bunch of barriers that potentially need to be resolved. And in all of these slides, I'm just showing you one page of the report, not every single word of every single section. But these barriers have also increased since our first iteration of the guidance from a few years ago, to really hone in on the sort of things that are coming up on a fairly regular basis in our deliberations with different communities and shelter providers on the things that are a challenge to being lower barrier or housing focused. So yeah, it includes things like, do you have adequate storage? And if people can't store their stuff, what does that mean? The challenge is if we require abstinence or cessation, or don't allow for people who are using to access our shelter facilities on a regular basis. The challenge that exists in some communities relative to couples and allowing couples to stay together. Pets, comfort animals, service animals. There's more barriers, obviously, than those. But when we start to think about that, the real orientation of thinking that should be taken by every shelter provider and community that supports shelters is let's go through an itemized listing of the barriers that exist as known by us. Let's ask community partners to identify any barriers that they see in our operations to allow access to shelter and focus on housing. And let's also, again, tap people with lived experience and expertise on the shoulder to ask what barriers they encountered and how those can be overcome in our pursuit of being housing focused. So you'll find in the guidance that this is a fairly robust section of naming a number of the barriers, why they're potentially problematic, and examining some potential solutions. In the space of progressive engagement, I think has become more and more of a buzz in our field the past few years. This idea of right sizing the amount of supports an individual couple or family is receiving based upon his, her, or their specific strengths and needs. So rather than over serving everybody right from the beginning, we start from this perspective of light touch. I give a little bit of assistance. I see how people are able to move forward with housing with a little bit of assistance. Okay, if they're getting stuck, I add a bit more assistance. All right, how are they progressing? All right, if they're still experiencing obstacles, I then add more assistance. But this is especially true for first-time shelter guests or people that haven't used shelter for a long period of time. Let's allow people to maximize their problem-solving skills with our support. So we're not just casting people away and say, go figure this out and come back to me. But we're really saying, like, we don't have to have intensive meetings and deep assessments if you're going to be staying for a short period of time and you'll be exiting for housing. That we deepen our knowledge and understanding of your needs if and only if there are specific obstacles in the way. This also allows us, this progressive engagement framing also allows us to examine the different steps of engagement in the process of housing focused shelter. So prevention, diversion, intake, opportunity for self-resolution, increased staff assistance with resolution as necessary, triage and assessment, assigning to case managers, following through in community relative to accessing housing. All of that progresses over time. So if we could prevent it, great. If we can divert it, fantastic. If we can plant seeds in intake, amazing, for people to be able to self-resolve. If they can't self-resolve, then let's get staff more involved. Okay, if staff are more involved, there still seems to be obstacles. Let's do a deeper dive, understanding some specific issues. Okay, now that we understand those, what's the plan going forward? So that progress of our engagement really helps us think through how we use our human resources within a shelter, who engages in those conversations. How do we target specific shelter guests with more attention over time so that no one falls between the cracks? We can also think through how we can use a progressive engagement model with existing shelter guests who are already experiencing chronic homelessness. So much of the conversation around low barrier housing focused shelter is around people newly coming in or people that are more episodically using shelters. We want to make sure that we're not losing sight of, in many communities and many shelters in many communities, there is a percentage of shelter users that have been part of either your shelter, other shelters in the community, or other shelters in the country for a long period of time. We want to make sure that we're putting some effort into assisting those individuals, couples, and families in also exiting shelter for safe and appropriate accommodation. In terms of what staffing looks like in this space, I think it's fair to say that the transitions in the expectations of staff is one of the most difficult parts of the process of becoming low barrier and housing focused. And you could probably break that down into both of those camps. There can be some staff resistance as you lower barriers. Fears of safety are probably the ones that come up the most. Feelings of loss of control, feelings that power is somehow being shifted, or that the environment will become so chaotic that work is not possible to be done in the housing realm. So we have work to do in that function of all staff roles. But on the housing side of things, we also look at specifically what different shifts within a shelter operation can contribute towards being housing focused. So one of the things that I think is really important to realize is that when we move from an orientation that says housing work happens through a housing specialist, and that regular, floor staff or direct service staff in the shelter maybe make casual referrals but don't actually engage in housing conversations, is that we miss this huge opportunity for engagement, reinforcement, and problem solving. So day shifts, if you're a 24/7 operation, have specific roles that they can play, from direct contact, leads on apartments, assistance filling out applications, tips and tricks for unit viewings, hosting housing oriented workshops, to what can the evening shift do? Well, or the afternoon shift. Well, they can follow up on the progress that people have made throughout the day in their housing journey. They can also provide feedback. They can also provide housing oriented workshops, seminars, etc. Maybe there's a social event or a movie event, and you do like just a 5-minute piece around housing focused work. But even the overnight shift can have a very important role in being housing focused. And specifically, we look to the overnight shift to be able to do things like get online and find available units for rent and make sure those are updated and posted every morning. That we can see the overnight shift creating resources that can be used by people seeking shelter. So tips, strategies, meeting with landlords, filling out applications, those sorts of things. It's not lost on us that when we think about moving forward in this way, the shelter probably can't achieve all of it by itself. And so what sort of partnerships become important are going to be have to be thought through and planned operationally. So for example, if I wanted to see staff specifically from a housing help service become involved in any way, shape, or form in the work that we're doing, well, what does that work look like in a shelter versus what does that housing help service look like in the community? Is it duplicating? Is it supportive? If I think about, culturally appropriate services for Indigenous people, what's the role of Indigenous-led and Indigenous service organizations to provide direct housing assistance to people who are Indigenous, who are in, let's say, a non-Indigenous shelter, and move forward in their pursuit of housing? And we can kind of think through as well how different health partnerships play into this role. And as part of Sandra's introductory remarks, she talked about the connectivity that's been heightened through COVID between the healthcare sector and the homelessness serving sector. There are a number of health resources that can be really beneficial in ensuring that we have stability and support moving forward, as well as addressing immediate health needs while people are in shelter, so long as we're not creating parallel health systems. The movement towards becoming low barrier and housing focused can require us to look at our rules, policies, procedures, standards, whatever they're called. Sometimes those words are used interchangeably, even though they mean different things, of what the shelter operations look like and where the housing orientation lies. So a few things that we can do to really improve that. One, you can have a review done by individuals who use your shelter in terms of what they think of your standards, policies, and procedures, whether or not they're low barrier and housing focused. You can have staff empowered within the organization to do a read through of standards, policies, and procedures and provide recommendations on how to lower barriers or be more housing focused. You could have a community shelter provider in a different part of your community, a peer operator, a colleague, take a look at your standards, policies, and procedures and provide a critique on how to make them more housing focused and low barrier. You could bring in other outsiders, but in almost all instances, in the projects that we've worked on with shelters to try to help them become more housing focused and lower barrier, is that there's been some blind spots in their standards, policies, and procedures, where one part of an operating procedure is actually precluding some other housing work from occurring, and that it wasn't necessarily known until we did the review that, this thing over here is actually interfering with our stated objective and progress. So that's one aspect. The other aspect of the standards, policies, and procedures is looking at it through a housing lens. Do these standards, policies, and procedures actually help people move forward with housing, or are they actually keeping people back in the shelter? And so one of the things that we also have to examine is whether or not there's any standards, policies, procedures, rules that are resulting in a number of high needs people being exited from the shelter temporarily, or even worse, permanently, and unable to access a pathway to housing through the shelter because they're unable to actually use shelter services. So all of these things come into our understanding of how we can improve the workflow. We also, lastly, will look at what in our other training materials we refer to as the Marvin Rule, which is once upon a time, someone named Marvin stayed at the shelter. Marvin did some weird and wonderful thing. So your shelter created a rule that had to be followed thereafter when it came to everybody. So an example of a Marvin Rule: once upon a time, Marvin accidentally, well, I shouldn't say accidentally, took some toilet paper, got it wet, threw it up, stuck it to the ceiling in the bathroom. And from thereafter, the shelter had a policy that, you couldn't have toilet paper in the bathroom. You actually had to ask staff for toilet paper. True story, an example of a Marvin Rule. But these are the sort of things that can be barriers to being low barrier, or can be barriers to being housing focused. The next part of the guide looks at how do we measure whether or not this is being effective. And there's really 3 performance metrics that matter the most. Yes, we can collect lots of data points, and that happens, I think, on a regular basis because of funders or expectations of just the culture of the shelter. We have loads of data in HIFIS, demographic data, service data, program data, etc. At the end of the day, what's going to tell us whether or not the housing focused element of the shelter is working? Well, there's 3 metrics we can look at and really focus our attention on, as opposed to a ton of metrics, to understand if this is working. The first is the length of stay going down? It doesn't go down overnight in housing focused shelter, because we still have the legacy of other people experiencing chronic homelessness. So if we just looked at averages, it can skew it. But if we look at lengths of stay by cohorts, newcomers into the shelter as opposed to everybody in the shelter, that length of stay should start to go down after several months of operating with a housing focused lens. The second thing we want to understand is, of all the people that have exited or have been served in the shelter, how many are exiting for permanent appropriate destinations? So again, housing in the general sense, everything from independent to supportive to family and friend reunification. So keeping track of those exits, we want that number to continue to go up. And then the third metric that we look at, which is important as a community, not just the shelter provider, is how many of the people that exited shelter come back and are served through shelter or outreach or a drop-in the future because they're experiencing homelessness again. This tells us whether or not the housing solution is sticking in the housing focused shelter place. So if we put our time and attention in those 3 key performance metrics, it is very broad stroke, but at least gives us some pretty clear indications of whether or not the work of being housing focused is achieving results. We want to make sure that the needs of various population groups are met. We respect the diversity that exists within the shelter environment. We know that the specific considerations of some population groups may mean that we can only look at our results when comparing that population group to itself as opposed to across others or to the general population. But it can be really helpful to customize our approaches in the space. How best do we work with Indigenous peoples? Are there Indigenous-led organizations or even Indigenous shelters in the space of being low barrier and housing focused? Are there other Indigenous housing workers who can be supplemental to the messaging that we have in-house relative to the work that we're doing to be housing focused? How do we best meet the needs of the 2S LGBTQ plus community? How do we go about being housing focused and safety conscious with survivors of domestic and intimate partner violence? How do we look at the needs of youth? And, there's so much we can borrow on that progressive engagement model relative to our understanding of how best to serve youth in the space. And we can look to some great organizations in the country that have done such a phenomenal job on the front end of prevention and diversion with youth, that the amount of youth shelter services has had to go down exponentially. How do we look at the needs of older adults, especially as we're starting to see data demonstrate that there's a number of people who are aging in homelessness, but there's also a fair number of Canadians that are experiencing homelessness for the first time as older adults. And then the needs of families, and that the sort of housing solutions or even the ways in which we contextualize and operationalize low barrier can be different for families than it can be for couples or individuals. Getting buy-in is not easy for low barrier housing focused shelter. In all instances, the approach that we need to take has to focus on several different groups to get their support for the work that we're doing. If we don't invest time getting support from these various groups, it can really be a thorn in the side of operations to be low barrier and housing focused. So we need our shelter guests, our shelter users to understand, and staff, we need their buy-in. One of the things that has happened in some of the communities that we've worked with or shelters that we've worked with is really seeing a conscious effort over time for the executive leadership team to be meeting frequently with staff, allaying their concerns, keeping a running list of potential obstacles to implementing low barrier housing focused services, demonstrating that that's been heard, understood, and is being supported. That the board of directors needs to understand what exactly is being aimed for, why this is important, especially if the board is not necessarily usually enlightened on operational matters, and they might think that, trying to keep people prevented and diverted from coming in or rapid resolution somehow is going to look negatively on the shelter. That's come up in a number of communities. The elected officials also need to understand. I have had several encounters with municipal elected officials in particular who seem to think that this orientation, they're shocked to learn that people leave shelter and go live in apartments in the community in a scatter site model. So I've seen pushback from elected officials who might have been under the impression that everybody who went to shelter could only go to like standalone supportive housing, but also making sure other shelter operators in the community understand. And this other shelter operator conversation can be a very interesting one. On the one hand, can be remarkably helpful. Let's get more shelters on board with being low barrier and housing focused, but can also result in some conflict, especially when the values of one shelter provider are different from the other as it relates to being low barrier or as it relates to being housing focused. And the next new section, as I kind of wind down the overview of the document, is how the heck do we maintain a housing orientation when throughout the country rents continue to go up, levels of assistance provided by provincial or territorial governments seems grossly insufficient to the cost of rent. What does it mean in terms of getting staff to focus on housing when there seems to be no housing to be had? And that's a phenomenal challenge. Nonetheless, shelters are not de facto housing. So yeah, two things can be true. We can have an orientation towards trying to help people exit shelter for safe and appropriate accommodation at the same time that we acknowledge that there is a scarcity of availability on the other side. So it can lead to some bottlenecking, no doubt about it, but it doesn't mean we give up on housing orientation just because there's scarcity of affordable, available housing out there. So some of the things we can be doing, expanding those resources for reunification. So this is a strategy that's been employed by a number of shelters we've worked with. There might have been a program that already existed in the community or in the shelter to help with some reunification, but by expanding resources, they're able to dig a little bit deeper into the level of supports that might be required for that family or that friend to receive the individual that's in shelter. Grocery cards, gas cards, utilities assistance, storage assistance, etc. We also see that there's an opportunity to really focus on the paper readiness aspect of coordinated access. If we have people who are coming to use our services, who are relying upon coordinated access as the conduit to exit shelter, well, we need to make sure that people, especially those with really deep needs, have all of their paperwork in order. I's dotted, T's crossed, documents received, safely stored, etc. We can also look at the ways in which we use our data for advocacy in this place. And we can start to talk about the needs of housing for people who are in shelter. What sort of price point do they need? What volume of people are we actually discussing? What's the nature of their needs, etc. So in summary, the document is intended to provide this broad overview. It allows us to see the potential for shelters to continue to align with solutions to homelessness rather than shelters being seen as the solution to homelessness. In the space of delivering housing-focused shelter, it really comes down to the thoughtful reflection of the practitioner, often in concert with community partners and end users of services to make these results real, and allows us to enter into a space where we can start to refine our policies, procedures, practices, standards, and rules to orient towards making sure any experience of a shelter stay is of shorter duration as possible, with the maximum number of exits to permanent destinations that are safe and appropriate. That, in a nutshell, is the document. It is certainly available through the Transformation Network. If you were interested in a deeper dive operationally in terms of what this looks like, I'm not trying to sell anybody on anything. Just if you were interested in deeper dive, there is a session coming up in a few weeks. Go to orgco.com. You can learn more about that actual training on delivering housing-focused shelter. But with that, I will draw my presentation to a close and turn it over to James for some remarks. Thank you so much.
Yeah, and thank you, Ian. That was terrific. A whirlwind review of, in many ways, best practices in the modern shelter. And I just, on behalf of everybody, thanks a million for sharing those reflections. I mean, for my part, I mean, just the idea of proactive, individualized, culturally sensitive types of services, having the capacity to be or to live those characteristics within our establishments is beautiful insight. The engagement of people with lived experience. This idea of progressive engagement is also, I find very, very interesting. Certainly, I would ask myself if that's indeed even particularly relevant for, if you will, guests with natural resistance to the accompaniment towards solutions. And the idea of problem solving as really the raison d'etre of the intervention staff is also a really interesting perspective. So anyway, I just so wonderful to hear all of that. Very refreshing and almost therapeutic. Thank you. The idea of these guidelines, folks, is that this is supposed to be a tool to help us kind of think at 50,000 feet about what we're doing. Are we orienting ourselves towards the types of solution orientations that are necessary to be that modern, progressive, successful shelter that I think we all want to be. And the hope is that these guidelines in time start to get perhaps appropriated by our sector. And I certainly, it's a question we're asking here at the Old-Brury. What part of this, in whole or part, it might be appropriate for us at what time. And this network is maybe a great way to start to test whether a tool of this kind may be a rallying cry for all of us, if there's some agreement around it. But we only gave ourselves an hour. Maybe we should have given ourselves a little bit more time, but I know everyone will have other things to do. We have 12 minutes left, and I don't want to deny anybody out there with the burning question the chance to ask Ian it. So if you have one, maybe put your hand up and so I can try to identify you somehow here. We have a fair number of participants on the line right now, and even if it's not a question, a comment on what do you think guidelines are a valuable potential tool for your organization in terms of guiding its future, its development in all the areas that Ian has gone through. It would be really welcome to hear some of those thoughts as well. So over to you. Anybody want to have a go? Anything burning? Oh, Daphne, please go ahead.
Hi, so yeah, my name is Daphne Nussbaum. I am the program coordinator and analyst for the Peel Alliance to End Homelessness. We work with a lot of homelessness serving providers in our region, most of whom operate shelters. I love the presentation. I think it's a great model. There are two areas that are one of the barriers. There's another barrier, and what's going on in our region right now is a lot of staff turnover in shelters at the moment. So there's a serious lack of consistency with how shelters are operating, and I think that they're, from my understanding, operating at the bare minimum. So I love the idea of bringing in these type of program and training, but what do you do when all these shelters are going through these incredible staff transformations? And the other thing I wanted to ask is, how do you get buy-in? How do I get buy-in from the region? How do I get buy-in from shelter operators? Again, I fully support this. It's just there are outstanding factors that are making it a bit difficult.
I'm sure James or Sandra may want to jump in particular on the kind of culture shift side of things. I know for sure Sandra has spoken about that a little bit before. I'll just speak to the staffing shortage side of things. I mean, it's real throughout the country. Not that there's comfort if you're trying to operate a shelter or you're supporting shelters in the community and say we have staff shortages, but it's happening everywhere. But I think it's a call towards how do we start to see shelter work as a profession as opposed to a stopover? And how do we actually recruit and retain people who want to make a career out of work in shelter as opposed to seeing it as a job? And I think this approach to mission driven work that it actually has a focus on a housing solution, it can and is being used in some communities now to recruit a different type of staff person than they have historically. So I think there's possibility there. It doesn't answer the immediate concern of how do we cover the shift today. But as we start to think around, from a management and leadership side in shelters, what type of person we want to recruit? Well, with proper compensation and a very clear guidance of what our objective is, we can get a different type of worker in space. And the other way that this work is, I think, improving is when we're onboarding new staff. we have a clearer sense of what we're trying to onboard them to be able to achieve. And so I think a lot of onboarding historically was, and good, right? Your safety, guest safety, colleague safety, procedures for cleaning and maintenance, and all the forms and administration, and the touch points with people for intakes and documentation, et cetera. All great stuff in onboarding. This allows us to also take a step to say, and when you do this work, this is what we're trying to achieve. And I think that sort of mission connection moves from functions of a job to impact of a job. And I think that goes a long way. Sandra, can I put you on the spot just to respond to the buy-in piece? Because I know it's something that you've worked with a lot in the DI.
For sure. And I think, well, of course, it's absolutely critical. And as Ian says, it doesn't happen overnight. I think, we had the privilege of having Ian come into our building and spend time chatting with staff, which really kind of started the reframe around the work and what we're doing. And I think as the executive director, one of the areas that I've been pushing externally and internally is really about getting away from output-based operations, so shelter nights, meals, pieces of clothing, all that sort of thing, to really that longer term outcome, which is a positive housing outcome. And that's where impact happens, right? So it's really shifting the whole framework around where the agency or agencies that you're working with sit in the system, and really focusing on impact and the outcomes has helped tremendously. And I think seeing that bigger picture that Ian was talking about actually serves as inspiration for a lot of the frontline staff, particularly once you start to have some housing success. For us, it was with our long-term shelter stayers who'd been in the building for 20 years. Once people saw them housed and thriving in their own homes, it really shifted, like, wow, this actually is possible, and look how great it's working. Didn't work for everybody. We lost people for sure, and that's okay, because they didn't buy into the philosophical shift. But as Ian said, we're attracting the people who do. So it doesn't happen overnight. It's communicate, 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 lots of conversation cafes, lots of town halls, and never losing sight of the end goal.
Nice. Yeah, definitely. I mean, certainly at O'Brury in the Montreal context, I'm not sure how many other Montrealers may be on the line, but yeah, we're like 10% of our staff at any one time is vacant, like staff postings. So it's wicked. It's wicked everywhere. And so yeah, share your pain. Sure. Any other thoughts, comments? Thank you, Daphne, for being first. Don't have tons of time left, but anybody else have something they want to add? So maybe I'll just ask. Well, not ask. I mean, for everybody, we have the CAEH coming up, of course, in a couple of months, a little less now, 7 weeks or so. Suspicion is that many of you will be there, or certainly your organizations will be represented there. And we're going to try to have a shelter network gathering there, and more information to follow. And we'll be asking about some topics that we may want to cover, and with the help of the CAEH, to try to poll you on what may be a good use of a block of time together. I mean, the shelters historically have really operated regionally together. They had, in some cases, provincially, never really have operated at the national level. It's one of the questions we'd love to talk about is this network, which is mostly pedagogical in nature. From time to time we'll have Ian or other guests on talking about various initiatives. Is there something a little bit more formal we'd like to create, or some objectives we'd like to achieve? Obviously, more perhaps towards the federal government than otherwise. And then within the network itself, such as, if we actually start to think about ourselves as a more formal network, do we want to adopt some orientations such as approval of or support of the org code guidelines as a kind of if you will, a North Star for our members to adopt. So, and those are some of the ideas Sandra and I, with the support of Tim and Michelle, at the CEH are talking about. So just want to let you know that. Sandra, anything else you want to add with respect to CAH?
I think just that we'd hope to operate a poll during this session today, and it just didn't happen. So that will be coming out shortly in the newsletter, which will ask a couple of questions around the conference, so that we can try to tailor our time as best we can. So look out for that newsletter that will come from CAEH and CSTN around those questions. So, and look forward to seeing everybody or many of you in November in 7 weeks or so.
All right, terrific. So unless there's anything else, we'll give you 2 minutes back here at just before the hour. And again, thank Ian. Thank you so sincerely for everything you've done, that you're doing, and you will do in the future, because we need you as our Sherpa on this journey.
Thank you so
Take
much.
care, everybody. Have a great Friday and a great weekend.
Bye now.
Bye.